Hi everyone, Tom again. Welcome to the third discovery module on AMD from VisionQuest. In our second module, we learned about the incredible high-resolution imaging available to you through your retinal specialist. The technology is amazing and surprisingly patient-friendly, with no X-rays or other harmful exposure. Now, I'm excited to introduce you to what is considered the most important driver of wet AMD. Like so many things in medicine, our topic has a pretty intimidating name: Vascular Endothelial Growth Factor. Don't worry, we'll get you comfortable with this. Let's use the common abbreviation VEGF. Here's Dr. Beck.
Hello again. You may have heard a strange abbreviation tossed around, VEGF. Well, it's short for Vascular Endothelial Growth Factor. Vascular refers to blood vessels in general, and endothelial refers to the cells that line the inside of blood vessels, including the small capillaries. So, VEGF is a normal body protein that appears to have many functions, some of which are listed here. Now, in general, most of these promote health, and VEGF plays a major role in blood clotting. You need to know that VEGF in the eye causes blood vessels to grow and leak. Wouldn't it be good then to block the effects of this protein in the eye? Well, we can, using drugs called anti-VEGFs, or VEGF blockers. Drugs, like chemicals in general, can be applied with spot treatment or more broadly. Anti-VEGF therapy is not given by eye drops, and it's not available in pill form. Now, this is usually when patients give me that look. The most effective method currently used for administering VEGF blockers is what's called intravitreal injection. Now, don't run away, it's okay. Let's look at this common and very safe procedure in greater detail. A mark about 3 to 4 millimeters behind the edge of the clear cornea would overlie an area relatively free of blood vessels. Let's look at this on a cross-section of the eye. An injection here is unlikely to result in bleeding into the eye. The pars plana is an area between the internal lens more forward and the retina further back.
The first injection, I was very, very scared. But after I got through it, I found out how easy it is and how well they take care of me. So it's no problem at all anymore.
When you're first told they're going to give you an injection in your eye, you want to pass out. It is so terrifying. They tell you it won't hurt. You don't believe them. But honestly, it does not hurt.
Of course, I was pretty antsy about it because I had not been exposed to it before. And then I heard about it and I said, geez, I don't know if I want to have a needle stuck in my eyeball or not. And did it, and found out it didn't really hurt, and we've been going since.
Well, here's a question. You didn't know there would be a test. True or false? A drug given by intravitreal injection stays in the eye. Well, the answer is definitely false. In fact, a drug placed in the eye affects the whole body, and sometimes to a significant degree.
Ideally, it dries up the liquid in your eye so that your vision is not as distorted. When there's a lot of fluid in the eye, there's a lot of distortion. And if the drug is working properly, it dries up the fluid.
So now you see there's no reason to be intimidated by this VEGF topic. It's a normal body protein, but it can work against us in the eye. We can block it if we want to with in-office treatment. And I'll get you up to speed on the currently available VEGF blockers in Discovery Module number 10.
So what we've learned together is that the main driver of wet AMD is a protein in our bodies called VEGF. If we use a drug that blocks VEGF, we deprive the wet disease of what really fuels it. What's not obvious is the fact that these blocking drugs, given by injection, don't stay in the eye. In fact, all VEGF from your head to your toes may be inhibited by drugs injected into the eye. Not exactly over-the-counter medications, are they? Work with your retinal doctor so he or she can understand the person hooked up to the eye being treated. As we'll see in the next Discovery module, there's no place for a cookbook approach to AMD. Make sure to join us, and remember, keep a steady heading and stay the course.